In this video, I am going to explain the advantages, disadvantages, and approaches of transdermal delivery system. In the previous video, I explained what a transdermal delivery system is, along with its components and termination enhancers. These are the main advantages of the transdermal delivery system. First one, avoid first-pass hepatic metabolism. Maintains constant blood pressure. Third one is reduces gastrointestinal side effects. Fourth one, easy discontinuation. Fifth one, improves patient compliance. Sixth one, suitable for unconscious patients. Seventh one, enhances absorption through barrier modification. And the final one is large application support. I explain more about these advantages. First point is it avoids them. That is, transdermal drug delivery system avoids first-pass hepatic metabolism. Normally, oral drugs go through the liver first. That is called first-pass metabolism, where a large portion may be broken down before reaching this circulation. So in this case, the transdermal delivery bypasses the liver initially. So more active drug reaches the bloodstream, which improves efficiency. And the second advantage is it maintains a constant blood levels for longer period. Transdermal patches usually release blood slowly and steadily. This helps to avoid peaks and troughs. Peaks means it causes the side effects, and the troughs are the loss of infection. So this transdermal patches avoids peaks and troughs, which leading to the stable therapeutic levels over time. The next third advantage is it decreases gastrointestinal side effects. Mainly, the oral drugs can irritate. Sometimes, in some of the oral drugs can irritate the stomach and the intestines. So, this transdermal drug delivery system have a property to bypass the GI tract. So, it reduces nausea, ulcers, and irritation. The fourth advantage of transdermal drug delivery system is that it is easy to discontinue in case of toxicity. That is, if any of the adverse effects occurs, we can simply remove the patch. By removing these transdermal patches, we can stop the further drug absorption through this skin layer. The fifth advantage is that it increases patient compliance. Patient does not need remember the multiple doses daily. Sorry, sometimes patients don't need to remember multiple doses daily. A patch applied once daily or weekly is convenient and it improves adherence. That is the patient compliance point. The sixth point is that it is useful for unconscious patients. That is, patients who cannot swallow. Sometimes some patients may be in an unconscious state, or sometimes they feel vomiting sensation. Such type of patients can use this transdermal drug delivery system. So it allows a continuous drug delivery without oral intake. The seventh advantage is that it can modify biological barriers to improve absorption. The formulation techniques like termination enhancers or microneedles can be used so that it increases skin permeability, which allowing better drug penetration. And the final advantage is that larger area of application as compared to buccal or nasal routes. That is, our skin is the largest organ of our body. So skin offers a wide surface area. This allows more flexibility in dosing and formulation when compared to limited areas like the nasal and the buccal mucosa. So these are the main advantages of this transdermal drug delivery system. Next, moving to the disadvantages. The main disadvantages of transdermal drug delivery system are: first one is requires suitable physicochemical properties. Second one is limited dose capacity. Third point causes local skin irritation. Fourth point is variable skin permeability. Fifth point, low overall drug permeability. And sixth point, not suitable for ionic drugs. Seventh point is cannot achieve high plasma levels rapidly. And the eighth point is not suitable for large molecular size drugs. So moving to the explanation. First point is that a drug must have a suitable physicochemical property. The skin, especially the stratum corneal layer, is a strong barrier. So only drugs which have a right lipophilicity, molecular size and potency can pass through it effectively. Second disadvantage is that dose limitation. Skin, usually our skin's permeability is low. So drugs needing high daily doses, which are difficult to deliver transdermally because no, not enough can cross the skin. Third point is local irritation at the application site. Patches may cause redness, itching, allergic reactions, etc. So this can be due to these reactions may be due to the drug adhesives or maybe due to this excipients. So irritation may cause at the application site. The fourth disadvantage is that variation in skin barrier function. Skin thickness and permeability vary by body size, age, individual differences, etc., which leads to unpredictable drug absorption. Fifth point is poor skin permeability limits drug delivery. The skin is designed to block substances, so only a small amount of drug can pass, limiting the effectiveness of many drugs. Sixth point is that cannot deliver ionic or charged drugs effectively. Charged molecules struggle to cross lipid-rich skin layers. So transdermal drug delivery is mainly suitable for non-ionized lipophilic drugs unless special techniques like iontophoresis are used. Next point is that cannot achieve high blood concentrations quickly because absorption is low. So it is not suitable for emergency situations where rapid drug action is needed. And the final disadvantage is that large molecular size drugs cannot be used. That is, big molecules like proteins or peptides cannot pass through the skin easily. It limits the transdermal drug delivery to small molecule drugs unless advanced technologies are used. So these are the main advantages and disadvantages of transdermal drug delivery system. Next, moving to the approaches. I just explained very briefly about this four approaches of the transdermal drug delivery system. First one is metric system. Second one is reservoir system. Third one is adhesive system. And the fourth one is micro reservoir system. So, in the first one, that is matrix monolithic system, the drug is uniformly dispersed within a polymer matrix so that it helps to release by diffusion from the matrix to the skin. This metric system or monolithic system is a simple design and which is widely used. Examples of polymers are ethyl cellulose, polyvinyl alcohol, etc. Next approach is reservoir system or membrane controlled system. In this system, the drug is contained in a reservoir compartment. So, a rate controlling membrane regulates the drug release. It provides a more controlled and constant release profile. The risk of this system is that dose dumping if the membrane gets damaged. Next, moving to third one, that is adhesive system. The drug is directly incorporated into the adhesive layer. So, the adhesive both sticks to the skin and controls the drug release in this system. It is a thin, flexible, and comfortable for patients, and very common in modern patches. And the last one is micro reservoir system. It combines features of both matrix and reservoir systems. The drug is dispersed as microscopic reservoirs with a polymer matrix, and it provides a controlled release with the improved stability. So these are the main four approaches of transdermal recovery system. First one, metric system or monolithic system. Second one, reservoir or membrane controlled system. Third one, adhesive system, that is drug in adhesive system. Fourth one is the micro reservoir system. Thank you.